Childcare and gender-sensitive training boost women's economic participation in East Africa. Efforts to enhance women's participation in the labor market through improved childcare services and gender-sensitive training are gaining momentum in East Africa. Recent research projects in Kenya, Uganda, and Rwanda have demonstrated that access to quality childcare and targeted training programs significantly impact on women's economic empowerment, time management, and decision-making in households. In Kenya, an initiative led by African Population and Health Research Center is empowering women in Nakuru County through access to quality childcare services. Patricia Wekulo, the ECD program lead at APHRC, explains that the study sought to evaluate the impact of the Kidogo program, a social franchise enterprise established in 2014 that helps women in low-income settings set up and run childcare facilities.
We carried out the study in Nakuru County because we considered this area a virgin study site, given that no such similar work had been carried out in this area. We sought to evaluate the impact of the Kidogo program on women's outcomes. Kidogo is a social franchise enterprise that was established in 2014, and they moved into Nakuru County just to support women in low-income settings, set up childcare facilities, and run the childcare facilities through the mentorship and coaching that the Kidogo program offered.
So as a result of this, two implementation components, the mothers would have, a peace of mind when they're sending their children at these childcare centers, and at the same time, they would also be able to save money, take loans, and engage in various income-generating activities. Additionally, we also had an advocacy component, both a bottom-up and also a top-down advocacy component, whereby we engaged local stakeholders, for instance, to support us in acquiring spaces for the childcare centers, in addressing various challenges that the childcare centers would be facing.
The study revealed that the Kidogo model is replicable with its 5-month training program for childcare providers, significantly improving the learning environment for children. Key findings showed that economic livelihoods of childcare providers improved as they attracted more mothers to their facilities and learned better financial management skills. One of the major impacts of the study was increased recognition of the childcare sector among county stakeholders.
One of the things that we found out through our study is that the Kidogo model it can be replicated. And particularly their training aspects, they took the mamapreneurs or the childcare providers through a 5-month training program where they trained them on different aspects such as how to provide appropriate care to young children, enhance the learning environment for young children, and also ensure that there are play materials available within the childcare facilities so that they can enhance engagement with the young children.
So Kidogo is a social enterprise that works in East Africa low-income communities with a vision of looking forward or imagining a world where every child, regardless of where the child is born, gets access to, grows to reach his full potential. And with that vision, we have a mission that now operationalizes our vision. The mission is to increase access to quality, affordable early childhood care and education in East African low-income communities. So in regard to GrOW project, it started all the way in 2021, and it was a project that was in partnership with APHRC. It was done in Nakuru West Sub-County.
Previously, there was no clear policy framework governing childcare facilities in Nakuru County. The advocacy in Nakuru County Childcare Facilities Act has also led to the introduction of the much-needed regulation and support for the sector. In addition to childcare interventions, gender-sensitive training programs for youth have also shown promising results in improving labor market outcomes.
One of the findings that stood out for us in our project was that the economic livelihoods of the childcare providers were boosted through this program. And we think that this was The pathway that this happened was through them attracting more mothers to their childcare facilities, and also them being able to track their daily expenses in a better way. In this way, they were able to identify how much they were putting into the daily running of the facilities, and also how much they were making from the services that they provided to the different women.
The Partnership for Economic Policy, PEP, implemented a project in 4 Kenyan technical vocational education and training institutions, targeting over 3,800 students between January 2022 and April 2024. Michael Morigi, the project's monitoring and evaluation coordinator, explained that students were divided into 2 groups, a control group receiving additional TVET training and a treatment group that received additional gender-sensitive soft skills training.
The project was on gender-sensitive training to improve youth labor market outcomes. So what we did, we were dealing with students or learners in these TVET institutions. So we did have about 1,700 young women and about 2,100 young men in this project. So these learners were categorized into 2 groups. We had the treatment group and we had the control group. So in the treatment group, beyond the traditional TVET training on technical skills, for the treatment group, they received gender-sensitive soft skills training, 10 modules, and the control group just received the traditional training on technical skills.
They're not doing childcare as a business. So we give them, amongst the trainings that we give them for the first 3 days, one of them is Business 101. So Business 101 is just to input into them the business mentality so that they perceive the work they are doing as work and not something they do when they don't have anything else to do. So after now they've been trained and they've successfully implemented the trainings for 3 months. Now we call them mamapreneurs and papapreneurs because from the entrepreneurial part of it. So that is where the genesis of the name comes in. Financial management, tracking their expenses, profit and loss, and looking at their income and like projecting, having a business plan, their expenditure and so on.
He added that the impact of training varied based on personality traits, with those having an internal locus of control benefiting the most. The study also found that women experienced greater benefits from the training than men, suggesting that gender-sensitive approaches can help bridge employment gaps in traditionally male-dominated industries.
The impact of the training on ultimate labor market outcomes differed across individuals with varying personality traits. We found that the training did improve labor market outcomes for individuals with internal locus of control. These are people who have personal control on their, or these are personality traits that can be explained as having personal control on your behavior. And so we found that the impact was higher for such kind of individuals as compared to those who lacked these attributes. And also these effects were higher for females than males.
In Uganda, a similar initiative led by the ACE Policy Research Institute, led by founder and director Jacqueline Makaru, has been working with the International Development Research Center on a project to support parenting care corners for vulnerable business women in Kampala's markets.
ACE Policy Research Institute is a think tank based in Kampala, in Uganda. We've been working with the IDRC on the GrOW project, on our project to support parenting care corners for vulnerable business women in the markets.
The initiative, which ran from 2021 to 2024, provided childcare options for business women operating in 6 markets. The study, designed as a randomized control trial, had 3 intervention arms: market-based childcare centers, childcare vouchers for mothers to use in community centers, and a control group.
What we did in this project was to provide childcare options for business women operating in 6 markets in Kampala. It was designed as a research study, as an RCT, randomized controlled trial, and we had 3 arms of this RCT. The first arm was providing care corners within the markets for women. The second arm was giving a voucher to these business women to take their children to a child care center of their choice. We did this study from 2021 up to 2024 when the cycle closed out. We had done a baseline, we did an endline, and we have done our data analysis now, and our findings are really, really interesting.
So as part of our project, what we implemented were basically about 4 interventions that we did. One, we established community-based childcare centers, mostly within public schools, and within those schools, the mothers were able to send their children at this childcare centers, and we also supported the organization of the mothers into women-led or mothers-led self-help groups, whereby they met regularly on a weekly basis to save money, to take loans out of those savings, and to also engage in income-generating activities.
Findings from the study revealed that women who frequently use the market-based childcare facilities were able to use their time more efficiently, focusing more on income-generating activities and personal well-being. Additionally, while there were marginal improvements in their business profits, the impact was not as significant as anticipated.
We also observed that those women who frequently used the childcare option, especially the market childcare options, their time use increased. They were able to utilize their time more efficiently. Whatever time they recovered from childcare at the workplace, they were able to utilize it more efficiently for either activities related to their social well-being or activities related to their work. Thirdly, we have observed marginal improvements in the profits of these women, but it wasn't as great an effect as we wanted it to be, so we are continuing to study this.